What we'd like to share with you now is the work of Community Jameel, and we're very delighted that George Richards has joined us, who's the director, to tell us a little bit more about their work on JPAL, which is a fascinating instant of philanthropy in Asia. George, thank you very much for joining us with us today and talking philanthropy. Tell us a little bit more before we learn a bit more from your video about this program.
Thank you, Ben, and well, thank you to you and all of the Talking Philanthropy team for having us here. It's a wonderful opportunity, and we're really honored to be amongst such a stellar lineup. Community Jameel is an international organization focused on science and technology in the fields of health, education, and climate, and celebrating the 75th anniversary this year of the Jameel family's philanthropy. One of our programs that we have supported over many years is the Untitled Chapter Poverty Action Lab, or JPAL, and it's my great pleasure now to introduce their work with a short video. Thank you.
Thank you. We look forward to watching it.
We see our role as piloting innovation and supporting ideas that unlock the power of data, research, AI, and other digital tools to understand and address pressing human challenges. The Abdul Latif Jameel Poverty Action Lab, otherwise known as JPAL, epitomizes that innovation and has had a remarkable impact. What started out as an idea in 2003 with a small group of development economists at MIT has now grown into a network of more than 500 researchers with offices in 7 countries, including Indonesia and India, and impacting 400 million people worldwide. JPAL is a global research center based at MIT that is working to reduce poverty and generate social change by ensuring that policy is informed by scientific evidence, working in collaboration with government and implementing organizations. JPAL conducts randomized impact evaluations to answer critical questions in the fight against poverty. Randomized evaluations are a powerful and innovative tool to answer those critical policy questions because they can generate clear evidence on a program or policy's impact, providing straightforward results that decision makers can apply. JPAL's health sector focuses on identifying policies and programs that effectively improve the reach, quality, and use of health services and products. This sector funds new policy-relevant research to improve health outcomes around the world, such as identifying barriers to the provision of critical urban services for poor communities and understanding the long-term impact of widely popular cash transfer programs on child health. JPAL's health sector also connects with government and non-profit partners to evaluate the effectiveness of their health policies and programs, ensuring that the most impactful and cost-effective are delivered to communities. One of the most impactful evaluations recently conducted by JPAL affiliates concerned immunization take-up in the Indian state of Haryana. Studies have shown that immunization is a highly cost-effective way of improving child survival. However, over 2 million children around the world die each year from vaccine-preventable diseases. As of 2016, only 62% of Indian children were fully immunized against polio and measles. Previous research suggests that offering incentives, sending reminders, and using influential individuals in the community can make parents more likely to vaccinate their children and increase child immunization. However, it is unclear whether these interventions work for larger communities or are more effective in tandem versus alone. To test this, JPAL affiliates and other researchers randomly provided incentives, targeted reminders, and local immunization ambassadors to communities in Haryana. They found that the policy that increased immunization the most combined local immunization ambassadors selected by the community, incentives that increased in amount across the immunization schedule, and SMS reminders. Today, the government of Haryana is working with researchers and JPAL to deliver the most cost-effective package of interventions. JPAL's health sector is now exploring new partnerships to advance early childhood development and reduce the direct and indirect effects of the COVID-19 pandemic. Although some countries are turning the corner of the COVID-19 pandemic through vaccinations, many countries in Asia won't see widespread coverage for months, if not years. In the meantime, there is an urgent need to equip vulnerable communities with the tools and programs to protect themselves. JPAL globally has a long track record of identifying effective, innovative means of increasing take-up of and access to health products and services, including preventing the spread of viruses through behavioral practices, including hand washing. In line with Community Jameel's commitment to collaboration, working with partners around the world, we are always open to exploring new collaborations with philanthropies, government, and researchers to achieve our goals of reducing poverty and strengthening systems in health, education, and climate resilience. Thank you.